is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, this is a medical minute from a case that we had a couple days ago. It was an elderly gentleman in his 70s, known history of diabetes, who kind of was brought in because of altered mental status. EMS noticed a significantly elevated glucose, just read high for them. And the patient did arrive. He was pretty somnolent. He looked very dry. He was tachycardic, hypotensive. And again, our glucose read very high. So we started doing some workup, and his glucose ended up being like 1,200 basically. Did not have ketones, but he, was hypotensive. We gave him fluids. He got better. And he had what's called hyperglycemic hyperosmolar state, which is something we don't see a ton. We usually think of diabetic emergencies as DKA. Hyperglycemic hyperosmolar state is kind of in the same spectrum, but it's a different patient population usually. It's usually older patients. It's usually people who have glucoses much higher than typical DKAs, frequently over 1,000. And the other kind of interesting differences are they don't usually have ketones. If they do, it's very mildly elevated, but they do have the elevated osmolality. Osmolality is kind of a measurement of concentration of chemicals in your blood, and in hyperosmolar state, obviously it's very elevated. The things that are kind of important is that the hyperglycemic hyperosmolar state actually has a much higher mortality than DKA, sometimes even 10 times higher than DKA patients. And some of that might have to do with the fact that these patients are older, they have other comorbidities, usually there's something else going on like sepsis or other things that tip them over. So we definitely need to be careful with these patients. Besides the regular things that we do of insulin, fluids, fixing electrolytes, which are similar to DKA, we have to measure that osmolality and actually follow it. If you correct the osmolality too quickly by giving them too much fluids and diluting them, they can get bad cerebral edema. So if these patients are going to be down in the ED for a couple hours, we should be checking that osmolality every 1 to 2 hours and making sure we don't drop that too quickly. So basically similar to how we treat DKA, but just a couple differences. They tend to be, sicker, older. And any questions or comments? All right, thanks, guys.
Hey, EMM listeners. We're excited to announce our upcoming event, Palliative, a community educational event exploring the nuance of pediatric palliative care on June 27th at 6:30 p.m. in the Anschutz Health Sciences Building. We will be screening the Emmy-nominated short film, Palliative, featuring Dr. Nadia Tremonti's work providing end-of-life care and easing the suffering of her patients and their families at Children's Hospital of Michigan. The film will be followed by a keynote address by Dr. Tremonti and a panel discussion with experts from Colorado's pediatric palliative care teams. Tickets are $30, and all proceeds will be donated to the Denver Hospice's Footprints program, the Princess and Superhero Party hosted by Children's Hospital of Michigan, and Emergency Medical Minute. There will be food and drinks served prior to the screening and during a brief intermission. Come join us for a thought-provoking evening with the community for our first event since the pandemic. Check out the link in our show notes to buy tickets. Thank you.